I think the environment has been
What we're saying is have a heart.
We've got to be able to regenerate our
There'll
economy.
be people who are kind, people who are cruel, but that's life. You can be bigoted about pigeons. I'm fine with that.
Welcome back. What we want to talk about now is what are the biggest killers, the biggest cancer killers in Singapore. And perhaps one of our good doctors will summarize for us what they are.
Well, I think if we were to talk about the highest mortality, it would still have to be lung cancer. We are curing patients, whether it be because of earlier diagnosis, with or without treatment, breast cancer as well as colorectal cancer. It's a combination of good screening techniques, understanding, education.
Are these the three biggest killers? Lung cancer, colorectal cancer,
Actually,
and
lung
breast cancer?
Lung cancer will probably be the biggest killer.
And the number two?
Number two, I think, is a toss-up. Stomach cancer is still pretty high.
Okay.
But we are curing patients with breast cancer and colorectal cancer.
Okay.
Statistically speaking, that changes all the time. Some years ago, we used to quote the fact that every year 400 ladies would die from cervical cancer. But now cervical cancer is nearly knocked off the top 10 list as a cause of cancer in Singapore. So with simply just quoting cervical cancer as a cause of cancer because of infection of HPV or human papillomavirus, we can screen human papillomavirus in ladies who are infected, clear the in situ disease before it becomes active cancer, and cure the disease before it even becomes invasive and has a chance to spread. But since this being Breast Cancer Awareness Month, I think may not be appropriate to discuss cervical cancer.
No, it is. But let me just
Yeah.
let's just clarify this point. You talk of cervical cancer as a cancer that has huge numbers of victims. But
In the
now
past,
through medical
yes.
treatment, that is almost non-existent.
We wouldn't say medical treatment because I would be the first one to say that we have not advanced in the treatment of cervical cancer, which is why education and screening is important in letting ladies know that if we can find the cancer and tame the cancer before it becomes invasive, then there is no cancer to talk about.
So there is a point beyond
Yes.
which it becomes
Yes.
dangerous.
Yes.
And we should catch it as early as possible.
We catch it in what we call a pre-malignant state. In Singapore, every woman who has given birth at a 6th to 8th week, when they go back for the check, they get a pap smear. And they should start having a pap smears once every 2 years. And if there's any abnormality seen in the pap smear, subsequent action is taken. And if there's pre-cancerous situation, some laser or simple small operation, which is a day surgery, and you're home and you're cured. No more problems. Of course, we continue to monitor. So the aim is to prevent any potential tumor, or rather potential cells which are already becoming abnormal, to stop them in their tracks.
Okay.
For example, breast cancer, since we're talking breast cancer awareness month, I think the data does show that in patients who go for regular mammogram are more likely to be caught very early in this pre-invasive state called carcinoma in situ. If a patient is treated for carcinoma in situ, the estimated survival at, say, 15 years is like 95-97%.
Without chemotherapy.
Without chemotherapy, virtually apart from surgery,
medication,
maybe some radiation,
nothing.
or just simple surgery, that's all.
So that's really the most important thing, to have
Catch
early
it early,
detection.
basically, yeah.
But if since we're in the early detection, if we're talking about the speed of cancer, I think Buncha didn't really have a chance to expound on that. There are basically slow-growing cancers and fast-growing cancers. There are slow-growing cancers that if a patient had that choice at an older age and say, I am not going to do anything about this, I'm just going to let it be, live with me, I'm going to tame it, whichever lifestyle changes I can, that can be done. We have managed and follow up breast cancer patients. We've got very slow growing breast cancer in elderly women, which we know in those ladies, it takes a very long and drawn out course, and patients can choose not to do surgery if it's found extremely early. But there has to be a choice between the patient, the physician, and the real speed of which the cancer is growing. Prostate cancer, for example, can actually live and die with the patient when the patient dies of natural causes.
And how long does that take?
Can go from years.
I mean, if you're in Britain, you're 70 years old and more, and you have prostate cancer, early prostate cancer, they don't treat you. You say, no, you probably outlive your cancer. You'll die before your cancer kills you.
There's also the belief that sometimes doctors are paying too much attention to cancer, and there's some practitioners who believe that cancer cells and precancerous cells are so common that nearly everyone by the late Middle Ages are riddled with them. And so the question is not so much is what do you do about it, but the marvel is that why don't they get cancer? So are we making too much of all these symptoms that we see about tumors and all that, or should we leave well alone sometimes?
The body has an ability to repair itself. Every cell that goes and undergo a damage, for example, by the toxins which we get, the ultraviolet light, the body is able to, the cell is able to repair itself. But we come to a point where it's overwhelmed, then it begins to become abnormal, then you develop a cancer. But by and large, I think, a reasonably decent lifestyle can help to enhance perhaps the body's ability to repair itself. But
so we don't have to treat every symptom.
I think we must understand symptoms. Like, for example, you have a runny nose, that's a symptom of flu.
Yes,
the
and you let it run its course without treating
that's
it.
right. We just sometimes just leave flu alone, you get better. All right, but the thing is, a symptom which is persistent, which, for example, a symptom which is serious, like bleeding, or breathlessness, or severe pain, has to be investigated.
Can it be reversed?
Let's get the correct terms. When a patient has a symptom, it means that he has a cough. A cough is a symptom.
Okay.
Or I have painful knee, that's a symptom.
Okay.
I have I have some abdominal wind, that's a symptom. But what is it caused by? That's the thing which we have to tease and make a decision. Can a person, is this person having something sinister behind all these symptoms?
So if you determine that there is in fact a cause that is
for example,
then you take
then we'll say, let's look, we investigate it, we find out why this person has, for example, change of bowel habits. Why is this man who previously would go to the toilet twice a day now is going 5 times a day, and he says, it's watery, it's mucus, and it's been like that going for 3 months, any loss of weight?
There's no chance of
pain,
reversal?
No. We then they'll say, okay, look, we don't know why you're having these symptoms. We need to correct them. Of course, along the way, he would have been seeing doctors who would have been perhaps giving him certain medications to try to reverse or stop the symptoms. Or maybe you went to Bali and that's why you're having this diarrhea and we're giving you some antibiotics. But they don't get better. And they continue to persist in the symptoms. So the symptoms keep on coming back. Then we say, look, there's something perhaps more sinister. Let's have a look. So you go for a scope and lo and behold, you found a tumor. And then we have to act on that.
Okay.
See?